Hey everyone, I'm Dr. Adam Silver, board certified cardiologist, founder and CEO of a new private membership cardiology practice here on the North Shore of Chicago called SilverHeart Medical Group. And I'm so excited to be able to offer my patients the kind of care they truly deserve: personalized, comprehensive, timely, responsive, unhurried. But I have to be honest with you, there's something that doesn't sit right knowing that I'll be going from treating thousands of patients a year to a much smaller number. There's a cardiology access gap crisis in this country that I just made worse. Half of all counties in the United States don't have a practicing cardiologist. It takes between 30 days and months longer than that for a patient to actually see a cardiologist from the time they were given a referral. And what are patients doing in the meantime? Well, naturally, they're turning to artificial intelligence, which would be all well and good if it wasn't potentially dangerous. Maybe you're somebody who saw an EKG report that you didn't like, or something on your echocardiogram, or you were told that you have coronary calcium, or somebody mentioned that you might have congestive heart failure or atrial fibrillation, and you want to look that stuff up. That makes sense. What doesn't make sense is that we now live in a world where it's almost impossible to get a hold of your doctor or your care team and have someone explain what those words mean to you while you're waiting to be seen. AI in a medical context is extremely helpful when doctors and nurses are using it for clinical decision support to make sure they're not missing things for complex patients. But for patients to be using it on their own, there is a high risk that you will either end up with a false sense of reassurance or going down a rabbit hole of anxiety and insecurity that wasn't necessary and may also be harmful. So here's what I want to do. And there's no catch here. There's no paywall. There's no secondary agenda. I'm not going to be selling any bogus nutritional supplements. I'm just genuinely worried about the population who's in medical purgatory, and I also feel conflicted about not treating as many patients switching to my new practice. Write the questions that you've been sitting with for yourself or a loved one into the comments section below. I will respond with videos translating medical terminology into layperson terms. I'll explain what a report is basically saying. Now listen, I'm not your cardiologist. I'm not pretending to be. I don't know you, your kidney function, your medications, your procedural or imaging or family history. That's not what this is. There's always going to be a bunch of legalese behind all of this, but let's at least get the conversation going so that you can sleep at night and have a more productive conversation when you do get to see your cardiologist. Thanks for watching. Spread this around. Check out my website, silverheartmd.com. Take care.